Diabetes management often faces challenges due to a lack of instant medical guidance, leaving many patients without immediate support. The Diabetes Healthcare Program, or DHCP, is an AI-powered healthcare application designed to simplify diabetes diagnosis, education, and patient support. DHCP combines machine learning-based diabetes prediction, interactive generative AI chatbot support, and visual health analytics with educational resources. It goes beyond traditional prediction systems by offering real-time medical interaction, providing immediate and personalized insights. The AI diagnosis module allows users to enter medical parameters such as blood pressure, glucose level, insulin, BMI, age, and genetic factors. The machine learning model then analyzes these inputs to predict diabetes type and risk level with high accuracy. Introducing Capsule, the intelligent medical chatbot powered by Google Gemini. Users can ask natural language questions about symptoms, health risks, medication guidance, and lifestyle suggestions. Capsule provides instant, human-like responses, significantly improving patient understanding and engagement. Animated charts and dashboards display crucial metrics like glucose level trends, medication versus non-medication comparisons, and overall patient health. These visual insights help both users and doctors quickly understand health conditions and make informed decisions. The Knowledge Center provides comprehensive educational content on diabetes care, empowering users with valuable information. Patients can also download medical reports to share seamlessly with their healthcare professionals. DHCP is built on a robust technology stack, utilizing Python and Streamlit for the web interface and scikit-learn for machine learning. Google Gemini powers the conversational AI, while Pandas, NumberPy, and Matplotlib handle data analysis and visualization. In conclusion, DHCP is a modern, AI-driven healthcare solution that empowers patients with faster diagnosis, better understanding, and personalized guidance. It makes diabetes management smarter, more accessible, and truly human-centric.